The Democratic Republic of Congo has declared a new Ebola outbreak in Kasai province, marking its first resurgence of the virus since 2022. Health officials confirmed the highly lethal Zaire strain after testing samples linked to 28 suspected cases and 15 fatalities. The World Health Organization has warned that case numbers are likely to rise as community transmission continues. Here's a report.
The horror of the carnage that a deadly viral disease caused in the Democratic Republic of Congo returned to haunt the nation early September. Health officials in the Democratic Republic of Congo have declared a new outbreak of the Ebola virus, which has killed 15 people since the end of August. The new outbreak is in central Kasai province. The last outbreak of Ebola in the vast Central African nation was 3 years ago and killed 6 people. 28 suspected cases have been recorded in Kasai province, according to provincial figures, with the first case reported on August 20th in a 34-year-old pregnant woman who was admitted to the hospital.
Unfortunately, some healthcare workers, including the nurse who treated her and the lab technician who took samples, developed the same symptoms 4 days later and died. In total, today, for the Bolap and Moeka health zones, we have 28 cases that have been recorded and we have had 15 deaths.
Case numbers are likely to increase, according to the World Health Organization, which has dispatched experts alongside a Congolese response team to Kasai province. The DRC has a stockpile of treatments for this viral hemorrhagic fever, as well as 2,000 doses of vaccines that will be moved to Kasai from the capital, Kinshasa. First identified in 1976 and thought to have crossed over from bats, Ebola is a deadly viral disease spread throughout direct contact with bodily fluids, causing severe bleeding and organ failure. The deadliest outbreak in the DRC, whose population numbers more than 100 million, killed nearly 2,300 people between 2018 and 2020. 6 strains of Ebola exist. Health officials say the Zaire strain, for which there is a vaccine, is the cause for the new outbreak.
Fortunately for the Zaire strain, we have a vaccine, but to deploy it, we must ensure, because it requires certain conditions, we must ensure all the logistics that are underway, and for the patients, the immediate management of their symptoms, but also we have in this case a specific treatment.
4 times the size of France, the DRC has poor infrastructure with often limited and poorly maintained lines of communication. Africa Bureau, WION World is One.